Now, we're talking a step further to understand why nutrition is key in managing type 2 diabetes, and we're doing so with the help of a clinical expert from the Prolepsis Institute in Athens. It's a pleasure to give the floor to Dr. Matina Kouvari, dietitian, nutritionist, and epidemiologist.
Okay, thank you very much. I'm very glad to be here today and presenting how the Cook2Diabeat started. And it started basically with the recognition of the actual need of this project and why we need it. Unfortunately, diabetes is very common around the globe, and it's also very common in Europe. We know that currently more than 500 million people around the globe suffer from type 2 diabetes. This is around 1 in 10 people that have this disease. And unfortunately, this number is predicted to rise to more than 600 million by 2030 and even more, close to 800 million in 2045. These are some projections that express an increase in type 2 diabetes around 50%. If we focus on the most vulnerable citizens, the most vulnerable adults, we see that 3 in 4 adults with type 2 diabetes come from low and middle income countries. This is also something that we have figured out in the research that we have implemented once we prepared this project. And this is a focus of the Cook2Diabeat project, which we will present later on. Regarding mortality, diabetes is linked with increased risk of mortality. Close to 7 million deaths in 2021 were attributed to type 2 diabetes. And this comes with the comorbidities that diabetes has. Diabetes usually results in cardiometabolic disorders and cardiovascular disease, and this is the main reason of morbidity and mortality in patients with type 2 diabetes. And the other major public health issue is the cost that type 2 diabetes has for the healthcare system. We know that diabetes costs right now at least $960 billion in health expenditure in order to treat these people and to treat their comorbidities. And we expect that this number will be 3 times higher, over the last 15 years. And here in this graph from the Global Burden of Disease study from 2021 with data from more than 200 countries around the globe, we see an exponential increase in type 2 diabetes prevalence from 90s to 2020, and then the projection for 2040 and 2045 are quite impressively high. So what we can do, here is the results from a very well-known clinical trial in Spain, the PREDIMED clinical trial with patients with metabolic syndrome, where we used a common, well-known, healthy dietary pattern, the Mediterranean diet. I'm glad that I'm coming from a country with a Mediterranean diet being our main dietary pattern. Spain does the same also. And here, as we can see in this graph, we see that people with metabolic syndrome that follow the Mediterranean diet, even enriched with extra virgin olive oil or with nuts, both good sources of dietary fats, had a lower incidence of type 2 diabetes 5 years later. And this is an impressive outcome for a dietary pattern which is a tradition for our countries. But diet is really important, but what we see now in the latest research is that lifestyle, other parameters of lifestyle are equally important too. So here in this meta-analysis of epidemiological studies, we see the added value of combining diet and physical activity in order to manage type 2 diabetes. The important finding also of this meta-analysis is that we see that when we achieve lifestyle modifications in type 2 diabetes patients, we have significantly better prognosis compared to just medication. So this is a really important finding. And we see sustainable changes in the lifestyle of in the quality of life of these patients, basically with lifestyle, not that much with medication. But the problem and the gap here is how sustainable are the dietary habits and the lifestyle modifications we achieve. So this is the main challenge we have, and this is how we decided to create a project like the Cook2Diabeat in order to achieve not only just dietary modifications for patients with type 2 diabetes, but also to achieve sustainable dietary changes. And what's the actual objectives of the Cook2Diabeat project is to develop an interactive training curriculum for patients with diabetes and their families. But what we did the culinary medicine. Professor Ruiz Canela will explain more on the approach that we followed in the Cook2Diabeat, but we decided that if we try to improve cooking skills to these patients, we will achieve changes that will have a duration. So in the Cook2Diabeat, we offer also upskilling activities to improve nutrition literacy, especially for those that are that come from low socioeconomic status, because this is, as I mentioned in the very beginning of this presentation, the most vulnerable people. Educate patients on sustainable food choices using a user-friendly platform. So we didn't want to develop something really academic, but we wanted to be straightforward to the target group. Ensure broad reach across EU patients and health professionals during and after project implementation. So as you will hear, our platform will be alive even after the project ending, and we will try to disseminate it as much as possible, not only today, but after the end of this project, to health professionals, policymakers, in order to make it part of a healthcare system, and enhance the competencies of healthcare providers and policymakers in promoting healthy eating habits. This is a main scope of the project, because we know that health professionals lack somehow actual education and knowledge on the field of nutrition. So that's it from me, and I will give the floor to Professor to say more details on our project. Thank you.
Thank you so much.